could you donate maybe your own body to support maybe a family?
I can't.
While you are donating the egg, you may bargain, I'm donating 10 eggs. And when the person that's collecting the egg collects 100.
Now, the only thing that can hinder people from having their desire now in terms of baby is money.
I can't sell my body because of money.
Some people might think of it as like, oh, she's doing it for the money. But on the positive side, you're helping a family.
One of the things that causes failure of IVF is embryo issue. Not all clients looking up to God for the fruit of the womb will require IVF.
Religiously, to my own belief, something like that is not permitted at all.
The pregnancy will spoil.
No, I can't do that.
So I said 2 of my children came through IVF and they are excellent children.
For generations, life followed a simple belief that having children would come naturally. No questions asked, no doubts imagined. But for many families in Nigeria, that expectation has become a painful uncertainty. Months turn into years. Questions begin to surface. Why is it not happening? Who is responsible? What are we doing wrong? And in a society where fertility is often tied to identity, the silence can be overwhelming. But today, science is changing that story. From fertility treatments to advanced reproductive technologies, a new path to parenthood is emerging. One that goes beyond what many once believed was possible. To understand this shift, I visited Prime Medical Hospital and Probryo Fertility Clinic, centers where science meets hope. Here, doctors and specialists are helping couples navigate one of the most personal journey of their lives.
Okay, we are a specialist clinic. We are the only clinic that practice regenerative medicine.
So what we do basically is fertility interventions. We do counseling, we do profiling of individuals, even before marriage and after marriage.
A specialist in the management of erectile dysfunction, fertility, arthritis, and the pains. We also manage fibroid without surgery.
For those that are married and are looking out to the fruit of the womb for certain time and they can't get it, we intervene, we profile them appropriately and recommend the best option for them, which ranges from just basic medications for them to get pregnant on their own, to correct certain things, and to IUI, to IVF, to surrogacy, to sperm donor, to egg donor, egg banking, donor, sperm banking, and embryo banking as well.
So if a woman carries a baby for another couple, such that the egg and the sperm belong to the couple, but maybe for certain factors, the wife could not carry the pregnancy. So who do you think is the real mother?
Well, I don't think there's anything wrong with surrogacy, because not everybody can have children the natural way. So if someone else can give birth, can have your children for you, I feel like it's right. So religiously, I don't think there's anything wrong with it. But some people, they have contrary opinions, and I try not to engage in back and forth. But if today anything happens and I'm able to get a surrogate, trust me, I'll pay the person to carry my child for me, and I'll get my child.
There are alternative means of getting pregnant. And apart from a man and woman meeting, coming together, we have what is called IUI, which means intrauterine insemination. In this aspect, it's a procedure whereby a woman will bring the sperm, the semen of a man, introduce it into the body of the woman through the vagina. Another one is IVF.
So IVF basically means in vitro fertilization.
Okay.
That's fertilization of sperm and the egg in the tube, which means outside the body.
Egg of the woman is brought out, now fertilized by the sperm of the man outside, and then introduced back into the body of the woman. That one is more obvious in the society today. You can see many people talking about IVF. We also have IUI, which I just mentioned now. Now, we make the sperm come closer to the egg. Before then, we have tracked the egg, monitor the egg, monitor the serial movement of the egg. When the egg is approaching the uterus, now we bring the sperm closer to the egg. So the sperm don't have to swim for too long to catch the egg. This one is called intrauterine insemination. The egg is inside the body of the woman, whereby we bring the sperm from the body from the man, introduce it into the body of the woman, so the woman get pregnant. That one is called intrauterine insemination.
As long as there's money, there are a lot of pathways open to people. But of course, it's not cheap. Anywhere in the world, IVF is not cheap.
What does it mean for a person or a couple to be considered infertile?
When a man and a woman is open to unprotected sex for more than a year, without the woman getting pregnant, that's when medically is termed that is the infertility.
When people go married, when they get married before the age of 35, they can actually afford to wait for 12 months, which is 1 year, of unprotected sexual intercourse. The reason is that it's not every month a woman can ovulate. And that a woman is ovulating doesn't mean she's going to get pregnant. So in 12 months, there's enough window of opportunity to conceive if it's going to happen.
Yes.
But when age is no longer on the woman's side, beyond 35 years, 36 years, you can't wait for more than 6 months.
When a man and a woman is open to unprotected sex, they come together regularly for more than 1 year, and the woman is not pregnant, did not get pregnant, then that's when is considered, infertility is considered. Below that, any hospital or medical personnel will ask you to hold on, wait, the patient until when it's more than 1 year. That's when the hospital or medical attention might be necessary.
The quality of eggs of women start going down as they advance in age. The quality and the quantity of the eggs.
But what do you think could be the major cause amongst patients, the major cause of this infertility?
Yeah, there are major causes of infertility. Diet-wise, environmental, disease condition, that's pathological condition. There are many which I may not go into details to mention. But for me, in the course of my practice, in the course of my research, I see ignorance as the major cause of infertility, both from the side of the man and from the side of the woman, because ignorance plays a major role. Some even women, some even men don't even know the right time to meet their wife for pregnancy to occur. They don't even know. Some don't even know the habit, lifestyle they're living that can even make them, that can even cause infertility later on in life. So because of that ignorance, a lot of things comes into play. So although there are pathological conditions that can cause infertility, infections, unhealthy diet, and then stress, accident, congenital abnormalities, structural damage. These are the factors that can cause infertility, both on the side of the man, on the side of the woman. My kind advice to so many of them that I have come across in my practice, I advise them early enough to go through tests.
Genetically, let's talk about compatibility. Have you ever had any situation where you've not been compatible with someone in terms of your genotype?
When you know you are AS, you don't need to marry AS, either as a man or as a woman. Don't let love blind your eyes, believing that there will be solution. So they may promise solution, but it doesn't work.
Do you currently know your genotype?
Yeah.
Based on your interactions with people, how do you think they perceive it when you tell them about this? Do they have that stigma? What do you think about that?
Yeah, culturally, as I have come across many of them in the course of my practice, culturally they believe that any conception aside from man and woman meeting, the child is not complete, it's not a real child.
In those days, in this part of the world, when a man and woman marry and they can't have baby for many years, sometimes they attribute it to witches and wizards. Sometimes they said they just divorce. They separate.
So the normal way that a real child comes into existence is by man and the woman meeting. So that cultural belief has a way of them coming with the multiple question. Are you sure the baby is normal? Even when you keep assuring them that the baby is fine, will be okay as a natural. But that belief, except if a man meets a woman, any that thing you are saying about conception is wrong.
Because of the advent of science and technology in vitro fertilization, that has been able to, the problem has been solved largely now, and people don't need to, go their separate ways before they have their desires.
Procedures like in vitro fertilization, commonly known as IVF, are giving new possibilities to those who once had none. Egg freezing, sperm donation, surrogacy, each option offering a different path but leading to the same desire. But with these possibilities come different questions. Questions about cost, accessibility, ethics, and belief.
I think the first IVF was done in 1976. So the first IVF baby eventually became a gynecologist and now have children. So in IVF procedure, what we do is that we first of all examine the couples to determine where issues are really. Is it from the man? Is it from the woman? So both of them will pass through a series of investigations, thorough investigations. And when results are out, we look at it and we sit down with them to explain the problem. The woman may have 1 or 2 or 3 problems. The man may have 1 or 2 problems. So we now put all the solution on the table for them on how they can overcome that and possible pathway for them to have their own baby.
Is parenthood defined by biology or by love and intention?
It's not everybody that is qualified for IVF really. Some people may have health challenges, IBP. If it's not being controlled properly, those kind of clients are not qualified for IVF. There are some conditions that must be met before a client can be qualified for IVF. Not all clients looking unto God for the fruit of the womb will require IVF.
It's very rampant nowadays, especially with middle-aged women. Most people are beginning to practice, or they're beginning to do something, they call it egg freezing.
Yeah.
Can you shed more light on that? Is it also a solution to infertility?
Egg freezing is occur for women who want to pursue their other academic, educational career, political career, or whatever they consider most important in their life.
Sometimes, especially this period of time in our life in this generation, where a lot of guys are not willing to get married until they actually make certain amount of money, and the women too, because they want a lot of independence, so they want to work. They are focused on their career to make more money, get stable before they can marry. So for them to checkmate time, some people will say, okay, I want to keep my egg now that I don't have a spouse, or my spouse is not available in the country and it won't be back until 3-5 years time, when I will have been 37, 38, when the quality of my egg will have dropped down. So I want to bank my egg down until the right man comes around. So that is egg freezing.
So they go about to freeze their egg. When they freeze their egg, they stop menstruating. No, any month a woman menstruates, she loses the egg. So it's -1. If she discharges 2 eggs, so it means -2. That month, that egg has gone. So when they have this kind of academic pursuit or whatever they consider mostly important in their life, no, they go ahead to freeze the egg, so making them not to discharge any egg until when they feel that okay, now they go about to unfreeze the egg. Now there is nothing bad in doing that.
There's another one we call embryo freezing. That one, the sperm has already fertilized the egg. We now freeze it until the woman that is ready to carry it is now ready. But one is more successful than the other.
But you have to consider nature. You don't choose nature. In one word or the other, later on, nature may answer you. It's just like you bringing a fruit you plucking a fruit now, you want to eat the fruit as fresh as it is. And then you keeping a fruit in the fridge, in a refrigerator for too long. Now, the nature, when you bring both of them out, the nature is not going to be the same. Even the nutritional value. So the same thing is applicable in egg freezing. Some of them will tell you, I think when I will freeze it, at least I will still be able to have my babies, but that's not natural means of getting pregnant.
Because when you freeze eggs, it's actually in fluid form. It's different from when sperm has fertilized it. So, and you don't expect the same quality when you now want to use it. So in egg freezing, the quality goes down very well at the point of needing it. Because this egg has been collected, it's a fluid-like thing, and by the time you want to use it, it's not going to be exactly. But in embryo, it remains the same. In fact, it compacts, it now expands back. When you are ready, it expands back to the fresh period before freezing. So you just transfer and they result in a lot of pregnancies.
You are not trying to apply artificial, which we don't condemn, but we try to make you reason that way that the nature, you can't cheat nature. When it's time for nature to answer you, you consider the healthiness of the egg you are freezing. When you unfreeze it, is it going to be the same with the natural one? No.
Then we also have sperm freezing. We have quite some of our guys that are not based in the country, their wife stays here, and they can't be coming to Nigeria every now and then. So when they come around, they bank their sperm. In their absence, we impregnate their wife.
When you mean they freeze, is the freezing done internally in the body or outside of the body?
Inside and internal, it's done inside.
We have a bank where we bank it. We use gas to bank it there. I can stay for 20 years, 10 years, as long as you want it, as long as they make payments to preserve it.
Okay.
It's there.
Okay, and now you made mention of the fact that an embryo freezing is the best option compared to freezing of the eggs.
Yeah.
So are there lifespans for both of them, either for the egg freezing or for the embryo freezing? Are there lifespan?
No lifespan, no. I said you can, I just said it down. You can bank your embryo for 20 years, 30 years. You can bank it. There are situations where people bank their embryo and along the line the woman dies. And the family or the husband to resurrect the memory of the wife. You say, okay, get surrogates for me to carry my baby.
Could you donate maybe your own body to support maybe a family?
Of course, yes. If it's my sister, I can do anything for my sister. So yes, I would be glad to do something like that. So I don't say big. I don't know why people think there's something wrong. I think I saw on Twitter that someone was saying the child is not yours. So far, he did not push the child out. And I was like, I don't know why women have to suffer. Like, if you don't suffer, they will not consider you like a good mother. If you don't go through the normal childbirth, like I don't know why that's why some people are over like I against CS. Because they believe that if you don't put the child out naturally, you've not done your part as a mother. So I think it's bull, to be honest. If my sister needs help, trust me, our sister would help out.
For treatments like IUI or IVF, at what stage in their treatment would you say that, you know what, this is the best option for you?
know, before we start sampling options for a woman as regards to infertility, we have to do thorough investigation and interview. Are you getting me? Yeah. We have to do thorough investigation and interview. We have to know how much curious are you to get pregnant? How old are you? These are what will determine our options to you. How old are you? Are you living together with your husband? How often do you people meet? These are options that determine, these are questions that determine options we're going to sample to you. There are, in some cases, we may overlook maybe IUI and step forward because of the situation that's surrounding you as a woman, as regards to infertility. We'll tell you, madam, go into IVF. There are options, there are situations we may find you. We'll give you a chance, we'll give you time. I say, madam, keep trying. Maybe one day, are you getting me? After correcting some abnormalities, either from the side of the man or on the side of the woman, will tell you there are chances for the woman to get pregnant. Are you getting me? So those options of IUI or IVF even test tube baby, there are one we call test tube baby. They are considered based on history. We don't just see a woman and say, oh yeah, go into it. When we are considered, we look at you, listen to your story, either from both from the man and the woman. Listen to your story, and we now try to consider your environment at the same time.
So there are some people that are married that they can't have baby simply because they are married, they are meeting at the wrong time. There are some couples that will come that probably the woman has some issues before, stress, getting worried unnecessarily, or taking certain medication that have deranged the hormonal profile of such a woman. If that's the problem, once it's corrected, they can get pregnant on their own. There are some people that it's because there is fibroid in the womb that is actually delaying them having their own baby, and the man does not have any problem with the sperm. So once this fibroid is removed, some of them get pregnant like that. There are some people, they have blocked fallopian tubes, but it's a temporary fallopian tube blockage. And once they do HSG, there's an X-ray for the fallopian tube to examine it. And the cost of testing is, some of them, the fallopian tube will get through. It's just like the inner side of the biro. Once there's a flush in there, the fallopian tube can, probably there's a clog in that pipe. And that's where the sperm and the egg will meet. So once there's a blockage, the sperm and the egg will not meet there. But once they do HSG, some category of people, they get pregnant shortly after that examination alone, no treatments.
So without considering those, looking into that question, we don't just look at the one and say, go into it, no.
There is still this common belief that infertility is mostly a woman's issue.
Yeah.
How true is it?
Yeah, it's true. Although many may doubt it, it's true. But I'll give you reason. It's true. There is no life, there is no time in a man's life a man is considered menopause. At any age may affect erection in men. It does not affect fertility. At any age in life, a man can make a woman pregnant, but considering that part of the woman. So a woman is time-bound. A woman within her reproductive age, she has a time that she will get to. She may not be able to get pregnant again. That's why you can see that infertility is more obvious, is more pronounced on the side of the women because they work with the time.
We've seen cases on the internet where I think for a man, you have the privilege. I think your sperm would keep coming. You don't have a certain fixed number.
That's not correct.
At any age, a man can get a woman pregnant.
From the 50 and above, men tend to have more abnormal sperm cells than normal. So the testicles are not there till eternity. Their functionality goes down as well. So what you see in a 60-year-old, 55-year-old, 60, 70-year-old man is that he will have sperm, but a lot of abnormal. And abnormal sperm cells cannot fertilize egg. So it's not as if men too have advantage. Yes, the testicle will continue to produce, but is it producing normal thing?
But that of woman is not so. That's why that infertility is considered more is more wide, it's more pronounced on the side of the woman than on the side of the man. Another area you look into is anatomical and physiological differences. Everything that makes you a woman from birth is already there. But the egg, a woman is born with her eggs intact. Right from the womb, God has already placed it there. Unlike a man. So that egg needs to be protected. You mind the environment, what you eat, don't leave any kind of, don't even expose yourself to any hack or anything that can damage the woman within. That is the side of the woman. But man stores sperm. A sperm is produced on demand. You can see, just like the eggs are already in the woman. So her lifestyle, she's bound to protect those eggs. She don't expose herself to so many any environmental hazardous or toxic that can affect the egg.
There are some men that is their sperm. Probably they have low sperm count. And once their sperm issue is treated, some of them will just have fantastic sperm cells. And they impregnate their wife on their own. So these are several other options. And there's another category where the man does not have any sperm at all. or the sperms are terribly bad. If the sperms are very low, there's another technology where we do the IVF, collect the woman's egg, and take a few of the sperm cells that we're able to see, inject it into the egg, like you force the marriage, you force the fertilization to happen, and it happens. Some people have their baby through that method. But in the situation whereby the man does not have any sperm at all, not having sperm at all even has variables. Some men, they produce the sperm, but the sperm refuses to come out. So what comes out in a man is not entirely sperm, it's called semen.
Yeah.
It's prostate fluid plus the sperm. It is the testicles that produce the sperm and store it. It's when the man is ready to ejaculate, the sperm will now move up, meet the prostate fluid, and come out as semen. So it's inside that semen that we look for the sperm. So in some people, the testicles is producing the sperm, but it's not coming out. So there's a technology that we have to go into that testicles to extract the sperm out, then fertilize with the wife's egg. So it's another way of doing that. But there are some people that they don't have at all. Those ones, we advise them to get donor sperm cells. And there are donors everywhere. There are people that are willing to help families, and provided they don't mind. And we ask our clients, what's actually your desire? Is it about your sperm or about your wife's egg? And come to think of it, who is a mother? Who is a father? A mother or father is someone that brought a child up, that trained, that take custody of that baby and raise the baby. So not necessarily the baby must come through the womb or through the genes of that man. So these are various ways people get solution to their problems.
If some people approach you and they say that, oh, they need to have children because they don't have children and you're a young lady, and can you donate your eggs for them?
I can't.
Okay, what if money
Why?
is involved?
I can't sell my body because of money.
I know in terms of the secular world, there are the people that actually don't actually see any kind of wrong in it, considering the technology advancement and everything. But looking at it from a Christian's perspective, it's just as if I've actually sold my child somewhere without actually having responsibility about him, having anything to do with him, which ideally it doesn't suit me.
What would you say about young girls who are donating eggs for money?
Well, we try as much as possible to discourage that.
People do things ignorantly without knowing the implication. No two women have the same number of eggs. One may have more, the other one has less. So while you are donating, do you know how many remaining?
But these days depends on the IVF center, and we have had several trainings. Even in this country, we have training every year in Nigeria. I go to America for Fertility conference every year, where all these things are being advocated. You see, to want to encourage young girls to donate for money is not the best. But that does not mean it's not happening. It's happening.
Truth. That's the question some of them can't even answer you. They see it as long as I'm a young woman, I can donate my egg. You are donating the egg, you don't even know how many number of eggs you have within. So when you are donating, do you know how many numbers remaining in your body? They don't know. So you are probably some of them have donated the eggs that God placed in their life for them to be a mother later on in life. But when you have donated all of them, tell me, when there is infertility along the line later on, who will you blame?
So what do you feel about young ladies who are very, I wouldn't say ignorant, but however, they do it for the purpose of money. For compensation, they donate their eggs, or they decide, they are doing surrogacy as a career. Maybe they just want to, for financial gain. What do you feel about that?
There's a positive point of view and there's a negative point of view. Some people might think of it as like, oh, she's doing it for the money. But on the positive side, you're helping a family. You're helping someone to become a mother. So I don't know, I won't think of it that way. Everybody gets what they want. You get your money, and a mother gets a child. So yeah, I don't think there's anything bad in it.
We also have people that are voluntarily coming out and say, I want to help people. I want to help people with my eggs. I want to help families with my sperm cells. I want to help people to carry baby because they cannot carry on their own. So in some situations, the intending family may want to at least compensate such people, because it's not easy to carry pregnancy for 9 months in case of surrogates. And for egg donor too, there are age limits. Anything less than 21 in our own facility, we don't collect their egg.
Just like while you are donating the egg, you don't know how many. You may bargain, I'm donating 10 eggs. And when the person that's collecting the egg, you collect 100. Yeah, yes, that's what happened. You want the person, you sign the person should collect 10, and he collected 100, which you don't know when the person is collecting it. So there's an advantage in doing that, in which if you know the consequences, so you be careful with what you are doing. You don't just donate egg because you're a woman. I can donate it. I can believe in that others, many are still remaining. Whereby you don't even know that the nature has already placed in your body, you have sold all of them out.
From around 23, 24, 25, that's fine. Because around that time, the young woman still have plenty of eggs to go around. And whether she donates it or not, averagely every month, every woman wastes average of 20 eggs.
When you will be looking for them, you don't blame anybody. Because you don't have none. Because no two women have the same number of eggs. One may have more, the other one has less.
It is not the egg that come out as menses.
Okay.
Egg is within the ovary. The menses is from the womb. So inside of the womb is like a beautiful table like this. And you now lay the sheet on it, expecting sperm and the egg to fertilize outside it and rolling to start growing. The moment that uterus, that womb, realize that nothing is falling in, it will remove the bed sheet. That's the blood.
Not the egg.
Not the egg.
Okay. So regardless of that,
the
we
egg
still
regresses.
lose 20 every month.
Averagely.
Okay.
So 20 eggs times 12 months, that's 240. The only difference is that when you now stimulate a young lady, rather than some of those eggs not getting to the required size, they will now come up en masse.
Okay. I know menopause is very closely related to infertility. Is that you don't have eggs anymore. That is why you don't bleed anymore. That's why you are menopausal.
Well, the how to explain that is that you see, ovary is a beautiful thing in every woman, and it is the ovary that makes a woman beautiful. So ovary produces what we call estrogen. Estrogen is the one that makes every woman beautiful, their face shiny, even when they don't rub any cream. So the moment the eggs are exhausted in that ovary still stop producing estrogen that will make the woman beautiful. That's when you begin to see wrinkles on the face of the woman. That's when you see them, the dark ones start getting darker, and the uterus will now say, we sense it, that this ovary is no longer producing eggs. So why am I preparing every month as if I'm expecting something? Let me close shop. So menses will stop, which is the menopause, because the ovary has stopped functioning. That's the way it was.
What was the medical inspiration for surrogacy?
So that's cosmetic. That one you said is cosmetic for women willingly choosing that they don't want to carry baby, even when they have the capacity to carry. The real essence of surrogacy is for people that cannot carry for medical conditions. Probably they don't have womb. Probably they have big fibroids that removing it resulted in them removing their womb, or there are some issues with the womb where the baby is supposed to grow. That's the medical conditions for that. Or a woman that is highly hypertensive, that carrying pregnancy may jeopardize her life. That's medical condition. But cosmetically, we don't allow that. For people to just say, I've seen a pilot that came and said, I'm earning 5 million naira. If I'm pregnant, I can't fly for 9 months. 5 million times 9 months, that's a lot of money. If I can pay someone to carry, why do I need to carry? That's it. So we see all manner of appeals, all manner of requests. But that's cosmetic, which is not medically allowed. You don't just go for operation, go for surgery, as if there must be condition for it. So that's it.
Would you be comfortable having your biological child, raised by someone that is not yourself?
Since everything is coming from me, just the lady carrying the pregnancy and everything. Because it's not as if the sperm is coming from anybody, it's actually coming from me. It has just been gone through IVF and fertilized and everything. So I actually don't see anything too bad. Since everything biologically is coming from me, just probably the woman doesn't have a kind of room to carry child and everything. So biologically, since it's my child and everything, I don't see anything bad in that.
Do you feel comfortable donating your sperm for someone else to have a child?
If it's not with my wife, I can't donate my sperm to anybody else. Religiously, to my own belief, something like that is not permitted at all. So donating my sperm to another person to have a child, for me, is zero.
Religiously, ethically, name it. It's a good thing. How do I mean? You are saving lives. You are saving lives. Even if you are donating your blood, you are saving lives.
So how would you feel knowing that your biological child is being raised by another family that is not yours? Because you've donated your sperm already.
It's a free word.
Success basically is age related, woman's age related. Like I said, the moment a woman gets to 35 and above, the quality and the quantity of the eggs starts going down rapidly. Once they get 37, 38, 40, it's almost non-existent. Now, if a woman is young, at the age of 30, 32, 33, 34, even 35, success rate can be as high as 70%. And if the man's sperm is top-notch. So that means it could be a passage issue that is causing the delay for them. So once those sperms are brought out, the eggs, not that the sperms are brought out, the sperms will be processed to remove the dead sperm cells, because all the sperms cannot be 100% alive. Some will be dead, some will be weak, some will be active. We need the actively motile one. Those are the ones that can run, hit this, select the egg they want to work with, fertilize it the following day. Then after 5 days, we put it in the wife and they get pregnant. It's as simple as ABC.
On the streets, opinions are divided. Some embrace these advancements, others remain uncertain, and many are still trying to understand. Yet, for those who have walked this path, the answer is often simple. It is about hope. The hope to hold a child, to build a family, to experience something many take for granted. As science continues to evolve, so does the meaning of conception, no longer limited to chance alone, but shaped by choice, technology, and possibility.
Before we, in IVF process, most of the time in our own clinic, we prepare our clients for at least 3 months.
Okay.
We provide medication, we give them medication to revive their egg. If the eggs are sleeping, to wake it up to be alive again. Then we trigger them for them to release those eggs. Then we go there 34, 36 hours later to collect the egg out. Meanwhile, the husband too will provide the sperm cells for us. We process it and combine it. So that's about 13 days already. So from the day we allow the sperm and the egg to get fertilized, the following day we see how many are fertilized immediately. That a woman give us 20 eggs and plenty of sperm cells from the man, it doesn't mean all the 20 eggs will be fertilized. So out of 20 eggs, for example, 17 may fertilized. We now watch those fertilization for 5 days. That 5 days, we are monitoring the growth of that's the embryo now. We are monitoring the growth. Is it progressing in order as it's supposed to be? After 5, some of them may die on day 3. They will not have the strength to continue to grow. But it's the one that is able to make it to day 5 that will say yes. Even that one, we have to still grade it. Is it grade 4A? Is it 2B? There's a grading method we use in the embryology lab. So we now determine the top-notch embryos. Those are the ones we now freeze or we transfer into the woman.
For somebody like to train, to born the child and give it to them.
Yes.
No, I can't do that.
Why?
My own child, why will I give them my own child? Even though I make agreement with them that maybe they will pay me money with their husband for me to born the child and give them. I will not see someone that will marry me respectfully like that after giving birth to that child, giving them. No, I can't give them my child.
Do you think it is okay for couples to use medical help to have children? Or do you think it has to be normal? It has to be natural?
It's okay for me. It is okay for a couple to seek medical care and in the areas of maybe childlessness or something. It is okay to seek a medical help for it.
Example, if a woman is less than 35 years of age, maybe 32, 30, 28, and the fallopian tubes are okay, such a woman does not need IVF. It's only in conditions where the age is not on the woman's side, the fallopian tubes are blocked, the womb, probably there is fibroids, there is polyp, a whole lot of things in the womb. Yes, such a woman can be considered, but not only woman. Before, it used to be women problem like 60%, men problem like 40%, but right now it's 50-50.
So you have to talk convincingly for them to believe that there's nothing like a cultural playing down on that you conceiving through IVF and the baby is not coming as a normal human being. No, it doesn't happen.
Men did not come to this world with any sperm cells. So some have, but all of them are dead. Such a man now cannot impregnate a woman naturally. There are some that have low sperm counts that can be boosted. There are some people, they have a lot of sperm, but abnormal sperm cells, So it depends on the woman and the situation. If a woman has been married for 5 years and she's still she's now going to 36, 37, and female factor is not the problem, then IVF should be considered.
Immediately a man is meeting a woman, that's when the sperm is produced. So they are not the same. That is anatomical and physiological differences. Aside from nature that places a woman within time limit or how to give all her children, all her birth. If she misses that period of time, it's considered menopause. Whatever thing that will happen after, you just consider 50-50. It may work, it may not work. But the man doesn't have that limited time of a productive age. At any age in life, I have a patient of 90-something years. His last child was 8 years. So you consider a woman of 90-something. Can you even reason you are getting pregnant? You can see nature. So fertility is more pronounced in women than men.
Nature is not balanced. Let me just put it that way. How do I mean is some are born to give birth naturally, some are born to give birth through CS, and some are opportune through financial capacity to go for adoption. So that's what I said, nature is not a such balance.
When you see a fowl laying egg, fowl don't lay the same size of egg.
Yeah.
So, but we need the good one, the good sized one. So those are the medications that will work for those things within 10 to 12 days. When we are able to achieve the size we are looking for. So the whole process of IVF in itself is about 19-20 days. If the woman wants to collect the embryo that same time. But it's not in all situations we transfer the embryo that same period. Some of them may have to pause for like a month or two, or probably they have something else to do, or we need to monitor them to ensure that the stimulation we have done, there's not going to be bad consequence from that. So we ask them just wait a little, 1 month, when your uterus is now ready, to grow the embryo, then we transfer into them. Then most of the time, there will be implantation. Egg collection is actually not painful because we do it under sedation. You know, we use needle to go there to extract, to suck the egg out. So it's under sedation so that it won't be painful to them. By the time they are awake, it doesn't take more than 10-12 minutes. We are done. So it may take 3 minutes before the woman will now wake up back to life. And that's all.
Okay, are there any risks one should really put into consideration?
Not really. The only risk is when it gets to a certain age. Like in Lagos, in Nigeria, for example, West Africa, Lagos State in Nigeria is the most regulated when it comes to health sector. So in IVF, there's a proper regulation in Lagos, and there's a law guiding what we practice. So beyond certain age, we are not allowed to do IVF for certain women. For example, when it's about 52, 53, beyond that, we can't do IVF. Of course, anybody that is 50 years may begin to have some health issues. So we don't want to compound that. What about if we put embryo there and the embryo divided into 2 or 3 babies being carried by over 50-year-old person? So which life should matter to us? The baby or the woman? I was on a TV station where I was invited to talk about this kind of thing. And I can tell you for free, all over the world, IVF is never cheap. And in Nigeria, for example, there's nothing we use in IVF that is made in Nigeria. The only thing made in Nigeria is we.
The brain behind it.
The brain behind it. Everything, including syringes and all that, medications, we don't do it. So, and when people tell me IVF is expensive, and I ask them, compared to what? Compared to childlessness? Compared to your happiness? Compared to America, where IVF costs between $25,000 to $30,000. So, in Nigeria, it will shock you that in Nigeria, IVF doesn't cost more than between 4 million to 7 million naira.
If the egg belongs to the owners and the sperm belongs to maybe the couple, but a surrogate is commissioned to be the one to carry the pregnancy, who do you think the real mother is in that case?
And technically and medically, the child belongs to the couple.
For 4 million naira, you can get IVF done in Nigeria successfully. And it's not every time people cover their own money. A lot of families get support. Most of the time, we even have some NGOs that sponsor people. They bring them, they pay for them, because yes, it's quite expensive. And does that mean when people don't have money, they won't have their child? No. So there are some NGO coming to such rescue, and quite a lot of them have been getting pregnant through that method.
If it happens that in the first cycle, there is no successful egg, because without all of those things, where you have the egg,
no conception.
Yeah. Is there any chance of doing it again?
So, like I always advise clients, it's always better to have good number of eggs, so that eventually we may have good number of embryos. So when we transfer into them, we have good embryos. If the first one fails, we cannot put all the good embryos at once. What we are allowed to put in Nigeria is 1 or 2 or maximum 3, and that's even on rare occasions. So if a client have like 7 good embryos, we put like 3, they have backup. So with that one being come out successful, they have opportunity of coming back, but we are not starting from the beginning again. We just to prepare the woman now to transfer the rest of the embryo and put them. Place like America or UK or Canada, before they transfer the embryo, they go into another level of testing, which we call PGT, that's pre-genetic testing, to actually understand whether that embryo is even able embryo. Because one of the things that causes failure of IVF is embryo issue. That embryo looks good under a microscope, it doesn't mean genetically it's okay. So, but going to that level is to know that PGT, we can actually know the normal embryo that's 90-80% can lead to pregnancy. Testing can also be done to identify AA or AS. In case of couples that are AS, AS or ACAS, the same kind of test we know. It's still genetic testing. To even know the gender, it's still the same PGT, but they are called different names. So it depends on what the clients want or desire. We've seen clients that have 4 girls, 5 girls, 6 girls, and desire a boy. So we can't just say we do IVF for such a family and just transfer blindly. That testing has to be done to identify how many boys, how many girls they have among those embryos. So it's another level of testing before we do transfer of the embryo into the woman.
Do you think it's okay for couples who could not have children naturally to use medical help to have children?
Why not?
With IVF, the chances of conceiving babies with maybe developmental issues is very minimal.
Highly minimal. In fact, it filters that. You know, in normal conventional or in normal childbearing, the sperm goes in, meets the egg by fire, by force, fertilize it, no examination, no extra care to select anything. So it's much more easier to give birth to an abnormal baby naturally than to give birth to an abnormal baby through IVF. Because IVF is a process. So some certain things will have been paused along the line of IVF before. I said it's either the pregnancy will spoil, it get aborted, or it doesn't implant at all. That's what we have seen worldwide.
There's no other clinic in Nigeria. There's no known clinic in Nigeria for now that practices regenerative medicine. All these things I mentioned now, we manage them conservatively, which means we manage all these things I mentioned, all these disease conditions I mentioned without surgery. So we manage them conservatively. This is called shockwave machine. Yeah, we use it in the treatment of erectile dysfunction in men. We also use it in the treatment of arthritis, both in men and in women. We use in the treatment of arthritis and pain. So we don't have to do so. Those people you can see sometimes you hear hip replacement,
Yes.
knee replacement.
Knee replacement.
With the machine, you don't need the hip replacement. We place you on EMTT machine. It knocks out that abnormalities, increases blood flow, so that healing will take place.
Okay, so in this clinic, Probryo Fertility Clinic, is this also provided as part of
Of course,
solutions?
we provide all manner of assisted reproductive technology, all manner, from IUI to IVF to donor sperm, donor egg, to ICSI, to surrogacy, all manner, whatever is going to meet up with the parenthood of families. That's what we're concerned about.
So if I want a child, I want a girl and a boy, and I'm specific about their genotype, and I'm specific about the quality of life they would live in terms of their genetic and everything. I can get that.
Of course, now, yeah. Those are basically what we do, and to the glory of God, quite a number of clients have been getting pregnant, and 75% of our clients actually are from diaspora. So I think our Dean is the one speaking for us abroad, and from Canada, UK, US, Australia, Germany, and some part of West Africa like Cote d'Ivoire, Togo, Benin, Ghana. All those countries are small, and they have limited number of IVF centers. And I can tell you for free, success rate in Nigeria is the highest. And donors are available. Either sperm donor or egg donor, they are readily available, and it's cost effective in Nigeria. It's cheap because we are spending naira, so people don't need to break their bank to have their baby.
Is this progress or interference with nature? So now I ask, in a world where creating life is no longer only natural, what truly defines parenthood?